Welcome to Winona Health. Whether you're currently expecting a baby or exploring your birthing options for the future, you're in the right place. Caregivers at Winona Health have been helping families welcome their newborns into the world since 1894. Our caregivers know that this is a special time for you, a time when everything matters, everyone matters, and every moment matters. To help you prepare for your birthing experience, we offer childbirth education classes and breastfeeding classes that you can find more information about on our website. Now, on to our tour. When you think you're in labor, if you're experiencing any concerning physical symptoms related to your pregnancy, come to Winona Health through the hospital entrance. Or if it's after 8:30 p.m., you will use the emergency department entrance. Stop at the switchboard window in the hospital lobby, and the staff will call the Family Birth Center to let them know you're here. One of our caregivers will come and escort you to your room. Our Family Birth Center is a secure unit, meaning badge access is required and all access coming or going is monitored. When you enter the Family Birth Center, you'll see our nurses station. This area is equipped with a screen that displays all active fetal monitor strips, so your caregivers are able to view your vital signs, contractions, and baby's heartbeat even when they're not at your bedside. Behind the nurses station is the nursery. We practice a rooming-in model of care, which means your baby will remain in your room with you. The nursery is typically only used for newborn procedures, screenings, and for infants requiring critical care. Your first stop will be in our OB triage room, where a caregiver will place a fetal monitor on you. We'll complete an assessment to see how you and your baby are doing. Once this assessment is complete, we will contact your doctor or midwife to determine what the next steps will be. If we determine that you're not yet in labor, we'll provide information about what to do next. If you are in labor, we'll get you comfortably settled in one of our labor and delivery rooms. The OB triage room includes a delivery area in case your baby is ready to be delivered before you can be safely transported to your labor and delivery room. We're prepared to care for you and your baby immediately. We use what's called the LDRP concept in our Family Birth Center. This means that you will be in the same room throughout your labor, delivery, recovery, and postpartum period. Some people find they are more comfortable walking during early labor, and unless you and your baby need to have continuous monitoring, you are welcome to walk in our Family Birth Center hallway with your support person. Each of our Family Birth Center rooms have a private bathroom with a jetted jacuzzi tub for your comfort, an adjustable bed that can be put into whatever position is most comfortable for you, a movable crib where your newborn can be placed when not being held and also for safe sleep, a whiteboard that is used to communicate important information about your care and your baby's care. It will contain the names of your caregivers and will be updated regularly. Each room is equipped with oxygen and supplies that can be used by our caregivers if your baby would need assistance immediately after birth. We monitor you and your baby during labor and delivery. We may use a wireless monitor to monitor your heart rate, the baby's heart rate, and your contractions. We also monitor your vital signs. Our caregivers want to support you and your birth plan. There are a variety of comfort measures available for you to use during labor. Some of these are changing your position in bed by raising the head of the bed or lowering the foot of the bed, using a birthing ball or peanut ball, relaxing in the whirlpool tub in your private bathroom if it is approved by your caregiver, using a squat bar that can be secured to your bed, using nitrous oxide, IV pain medication, an epidural, or a spinal block. With our rooming-in model of care, your baby will remain with you in your room throughout your stay. After delivery, we'll add a special mattress to your bed to make it more comfortable. It's important that you are able to rest, and we do everything possible to help make you comfortable. Your partner or support person will be able to stay with you and your baby if you wish. Our in-room sofa converts into a bed. We want them to be comfortable too. A nurse will help you give your baby their first bath. This is a special bonding time with your baby. If you choose to breastfeed your baby, our caregivers and lactation consultant are here to answer your questions and to assist with establishing breastfeeding. A breast pump is available for use if it becomes necessary. If you choose to feed your baby formula, we'll provide formula during your hospital stay. Our caregivers are available to answer your questions and support you as you learn to feed your baby. We'll also provide diapers and wipes as you take care of your baby throughout your stay. As you prepare to go home, we want to help you celebrate your new family member by serving a special dinner for you and your partner or support person. Some of the things you'll need to bring to the hospital as you prepare to take your baby home include your baby's car seat, clothing, and a blanket that is appropriate for the outside temperature. If you haven't yet chosen your baby's provider, we encourage you to do that before you leave the hospital. We have wonderful pediatric caregivers, so you and your baby will be in good hands throughout all stages of growth and development. Before you and your baby leave the Family Birth Center, we'll answer any questions and provide information that will be helpful to you in your transition to caring for your baby at home. Remember, after you go home, we are always available by phone if you have questions. We hope you'll take advantage of our weekly All About Baby group. This is a fun opportunity to meet one of our nurses, weigh your baby, ask questions, and meet other parents. We'll give you more information about this group before you leave the hospital, and you can also find information on our Winona Health website. Thank you for taking this tour. We hope it was helpful for you. Please let your doctor, midwife, or one of our nurses know if you have any questions. We wish you a happy, healthy pregnancy and look forward to caring for you and your baby at our Family Birth Center.